My name is Keith Aguilar, and today I'm going to be doing my YouTube infomercial on marijuana, the drug marijuana. So, what is marijuana? Marijuana is a drug that's composed of dried leaves, flowers, stems, and seed from the sativa or indica plant. Marijuana is primarily popular for the chemical tetrahydrocannabinol, or better known as THC. Marijuana can be consumed by vaping, smoking, or being put into foods or other candies in the form of edibles. Marijuana has various effects on the users, both positive and negative. The specific effects can vary depending on the individual, the potency of the marijuana, the method of consumption, and other factors. There are both positive and negative effects. Some of the positive effects include a feeling of euphoria or happiness, increased creativity, introspection, a sense of relaxation or decreased anxiety, increased appetite, and pain relief and reduced inflammation. Some of the negative effects include impaired memory, difficulty with attention and concentration, impaired coordination and reaction time, which can increase the risk of accidents and injuries, increased heart rate and blood pressure, dry mouth, red eyes, and coughing, anxiety, paranoia, and panic attack with higher THC, addiction withdrawal symptoms with frequent or heavy use. So, as you can see here, it can affect the brain in a very negative way, right? With the sense of impaired coordination reaction time, and also with the anxiety, paranoia, and panic attack. It affects the body with an increased heart rate and blood pressure, which isn't good for some people. And with red eyes, like cotton mouth, coughing, and stuff like that, that can really affect someone badly. And like obviously, like psychological, like addiction, withdrawal symptoms, nothing ever good comes from that with any kind of drug. So, negative long term effects of marijuana: addiction, which can lead to dependence and withdrawal symptoms when the drug is not available, respiratory problems such as chronic bronchitis and lung infections, especially with frequent or long term use, cognitive impairment, especially if use begins in adolescence or continues in adulthood, which can affect memory, attention, IQ, mental health problems such as anxiety disorders, depression, and psychosis, especially in individuals with pre existing vulnerability to these conditions, impaired immune function, which can increase the risk of infections and cancer. So these are some statistics on marijuana. So according to the National Institute on Drug Abuse, marijuana use can be addictive. About 1 in 10 marijuana users will become addicted. For people who begin using before the age of 18, that number rises to 1 in 6. Marijuana use can have negative effects on mental health. According to the National Institute on Drug Abuse, marijuana use can worsen symptoms of anxiety, depression, and bipolar disorder. It can also worsen psychotic symptoms and disorders such as schizophrenia. Marijuana use can have negative effects on academic and career outcomes. According to the National Institute on Drug Abuse, marijuana use during adolescence can cause long-term changes in the brain that can affect memory, attention, and intelligence. These effects last for days or weeks after the drug's effects wears off. So overall, it will affect the mind in the long run as well as the body, which it makes it a very negative effect drug if used too much and incorrectly. And then there are my sources. Thank you.